Dear Shockwave family, my next talk is on shockwaves in lymphedema, my conflicts of interest. If you look in the global trends on research in shockwave medicine from about 2 decades, you can see in the upper part lymphedema still noted. So there are obviously even researchers doing some work on lymphedema. The first publication dates back in 2010 or 11 from Japan, where shockwave was used to promote lymphangiogenesis in secondary lymphedema I think in ears of rats, and you can see that the ear thickness in the shockwave group was significantly reduced in a lymphedema model, in contrast to the control group, which was supported by histological changes. Furthermore, it could be shown in this very first trial that VEGF-C, the vascular endothelial growth factor subtype C, which is relevant for lymphangiogenesis, is significantly improved in contrast to control, as is the VEGF receptor 3. VEGF-C is, as I mentioned, promoting lymphangiogenesis, acting on lymphatic endothelial cell, and was discovered in 1996. And as you see, there is a huge family, like we have a huge shockwave family on the VEGF level. So there are VEGFs much more prone to for vascular angiogenesis, hemangiogenic VEGFs like subtype B, F, A, and E, and more lymphangiogenic VEGFs like VEGF-C and VEGF-D. So it really depends on the subtype, like on TGF beta, alpha, beta, and gamma, and so on, which growth factor in which direction is getting. So it's shown that VEGF receptor is improved in line with an improvement in lymphangiogenic vessels. And the second study, published again from Japan in 2011 in a rat model, they used rather high electromagnetic energy, 0.25 in rats, 500 shots, and did a study on the rat tail. So they did a circumferential injury, and distal to the circumferential injury, there was a secondary lymphedema, and then control or shockwave group were studied, and you can see over the time course in red shockwaves, in blue the control group, that shockwaves applied in this fashion 4 times could significantly improve even after 1 week the lymphedema, in contrast to the control group, quite significantly. This was in line with a better fluorescence intensity in the rat tail, and as well as in histology on the thickness of the subcutaneous tissue. So all these items were significantly improved. In this pilot study on forelimbs, could be furthermore shown that, again, in this case with a radial device only, you see 500 shots, 0.05 millijoule, rather slow with 3 hertz. There was a significant improvement in the VEGF receptor and VEGF-C. And I mentioned before in the cellulite talk that the oxidative parameters in lymphedema could be significantly improved with every session of shockwave. I highlighted shortly our randomized control trial, and you remember this lady with a significant cellulite and lymphedema, and you see that focused alone at that point of time could significantly improve it. And now, 15 years later, I would add radial as well as vibration therapy in order to further enhance my treatment effect. And this is secondary lymphedema after breast cancer, as you can see here, after lymph node surgery. And the first trial, published 11 years ago already from South Korea, included 7 females with lymphedema grade stage 3 after chemo and radiotherapy. And the application of focus shockwave could significantly reduce the volume of the upper extremity by some 37%. On different, the circumference was better, the skin thickness improved, and both skin hardness, edema, and sensory impairment could be significantly improved by this non-invasive measure. In the further course, a lot of breast cancer patients have been studied in controlled trials, as you see in this trial from Egypt. 16 sessions of radial pressure waves, 2,500 shots, 2 bar, 4 hertz, again, rather slow. And you see the changes in the volume, and at 8 weeks it became significant. So the shockwave group was superior to the control group with these parameters. So rather often and rather slow treatment. They did the range of motion, both on the shoulder external rotation and the shoulder flexion, which improved with the shockwave as well, and concluded that it is an effective modality in the treatment after breast cancer operation with a favorable outcome. Another pilot study now from Turkey used or included 11 females after a huge patient cohort was recruited with this type of radial device from Elmate, 12 sessions, again 4 hertz, so rather slow. And you see the improvement in the volume over 6 months. After these 12 sessions, same holds true for the quick dash, with a patient-related outcome measure up to 6 months. So better results. And going back to Busan in South Korea, where we had in South Korea, as you know, our nice Daegu meeting last year with a focus device by Dornier, as you can see, a significant improvement in terms of volume, in terms of water content and skin thickness in the shockwave group, which was highly significant, and patient benefited with a reduced edema and skin fibrosis without significant complications. And it was advocated that shockwave can be used together with manual lymphatic drainage, so complex decongestive physical therapy. There is even a very nice study from Belgium, and as you might remember, I was, let's say, trained in plastic surgery as well. And when I was in the plastic surgical department from 2006 to 2012, we started with microsurgical lymph node transplantation. And that's why I got to know Mustafa Hamdi, who is one of the most famous lymphatic microsurgeons from Brussels. And in this trial, which was awarded by the ISMST for a lecture prize as well, patient underwent either lymph node transplantation or lymphovenous anastomosis, so it's microsurgical lymphatic operations, 10 patients in total, as you can see here, which is done under the microscope or super microscope. And then the MTS Dermagoib 100 was used 8 sessions, 0.1 millijoule, 2,600 shots after surgery. And it was shown that even in these lymph microsurgically treated patients, electrohydraulic shock waves could significantly improve the volume, as you can see here on the forearm, in the box plot as well, and the hardness of the skin significantly. So this is, in my view, still the first and the only paper showing that the combination of lymphomicrosurgical operation and focus shockwave can significantly enhance these results in really end-stage lymphedema patient. And you see, for example, this is a patient referred to my clinic after bilateral thigh lift with significant lymphedema and pain in this location. And I started focused in radial shockwaves in combination, as I mentioned before. And you see, this is after one single treatment before I start at this region. And this was the first visual, let's say, evidence for me that there are even immediate effects on the redness of the scar and on the lymphedema. So you will really improve the quality of life of these patients. So rather similar to what I told you in cellulite, but with a bit lower energy flux densities. I'm combining focus shockwave 0.07 to 0.15, 2000 shots, radial pressure base 0.8 to 2 bars, 8 hertz, rather slow, and vibration, following the lymphatic pathways on the upper or the lymphatic, the lower extremity. So you have to know where the lymphatics outflow is. This it can be incorporated in the lymphatic therapy 4.0, where lymphatic massage, compression therapy, and kinesiotaping are put in combination with radial and focused and vibration shockwave. So something new to the end. I told you that I want to highlight some things going to the brain. And the meningeal lymphatic function is coupled to microglia and brain vascular activation. And it is known that the dural sinuses, there are some of them, act as a neuroimmune interface. There are postulations that maybe even the meningeal lymphatic vessels regulate the brain tumor drainage and even in neurodegenerative diseases like Alzheimer and Parkinson, there's an accumulation of, for example, amyloid plaques, and the clearance of these amyloid plaques is not working properly. So this might be, and you will hear from Karin and others, much more on the TPS, on the application of MRI navigated focused electromagnetic shockwaves on the brain, which looks like this. So we can see in real time on three axes, and by color changes the amount of shots we applied. And my idea is to combine focus shockwave on the brain as TPS and on the neck with radial to enhance the lymphatic blood flow. So, and if you look in anatomy, there is the sinus sagittalis, the sinus transversus, and the sinus confluens, who are the main, let's say, anatomical hallmarks for lymphatic drainage. And you see the way is from the front to the occiput and from central to lateral in the sinus transversus. And following these anatomically guidelines, one might use TPS like this on the sagittal. Now I'm doing it from frontal to occipital only and go only from this direction and not second pulse as I do it in this video, as you can see. For sinus transversus, I will go from central to lateral to enhance the brain lymphatic outflow. And this is radial pressure wave on the neck to further enhance the outflow and to further relax the quite tense cervical muscles after 30-45 minutes of TPS here. So I conclude shockwave can induce VEGF-C, which is the lymphangiogenic growth factor. Both radial and focused shockwaves improve secondary lymphedema. It seems from the studies that you need more radial than sessions in contrast to focus sessions. Maybe the combination is even better. The more sessions, the better it is. And vibration tools play a paramount additional role in my view. Thank you very much. Gracias a todo. And have a nice further conference. Yours, Carsten.